Talking about the unexpected death of Dr. Donda West, the beloved mother of hip-hop superstar Kanye West. I want to bring Dr. Trokel, Dr. Jan, to people who know him, a cosmetic surgeon with the Jan Center for Corrective and Cosmetic Surgery, into our conversation. You know, because before going under the knife, there are many precautions that a patient needs to know about. And Dr. Jan, why don't you just lay that out for us? We've heard this term medical clearance. What does that mean?
You know, I think cosmetic surgery is such a great thing because people can come and they can take away all the things that they really worry about. If they have a problem, they want to look better, they want to feel better. Cosmetic surgery, though, is surgery. And I think we need to really understand that, and we as doctors owe it to our patients so that they can understand the importance of surgery and the complications and risks.
Anytime there is anything invasive, there are risks to that. Anytime that you're going to have any drug put into your body that will render you unconscious, there's risk to that.
Right.
Will you please lay that out so that our audience understands?
So I think that any procedure that you have, especially surgery, and you're going to be put under general anesthesia, you need to be fit to undergo that stress. General anesthesia and surgery is actually the biggest stress a body can take. And in order to perform it successfully and for a patient to come out of it successfully, they have to be ready for it.
And the kind of surgery that the surgeon who has stated for the record that he did in fact perform the procedures, that would have required general anesthesia for the most part. Is that fair?
Right. For a breast reduction and for a tummy tuck procedure, it would require some sort of an anesthetic.
So what could have possibly gone wrong? And this is where I know my audience is saying, I want to know this, so that there is no question. After surgery, immediately thereafter, and then subsequent, there are issues. What could go wrong?
Right. So actually there's two times when something can go wrong. Actually, intraoperatively, or during the surgery, or afterwards. Now usually, so from a surgical standpoint, the problems that can occur is like bleeding, or a blood clot can form, or some sort of like a internal injury to some organ.
Right.
Right. Anesthetic-wise, right, the anesthetics that are given to the patient renders them unconscious, and that can actually cause some problems.
So that can happen while you're on the table.
Right.
Subsequent to you getting off the table, everything may look good, but then there's still additional risks.
Right. So immediately afterwards, there can be still drugs that are lingering on that can actually creep up, let's say, 6 hours later, 4 hours later, and that can cause someone to stop breathing.
Which is one of the reasons why people are usually closely monitored in recovery afterwards for a certain amount of time. And then subsequent, you're given instructions after surgery what you have to do at home or at whatever aftercare facility that you're going to be in, and you must follow those instructions. Tell the audience why.
Just for those reasons alone. And I think that the caregiver of the patient during surgery and after surgery, whether it's a nurse or a family member, really needs to keep a close watch on the patient and make sure that nothing is going on. And at the very first sign, they should get help.
I was a little concerned when I heard Dr. Andre Aboulian's statement. This is a surgeon who allegedly Dr. West came to visit or consult, and he said that, you know, there was a need for a medical clearance, which I know has to happen, but he made a statement that, you know, he always insists on medical clearance for women over 40, et cetera, et cetera. I found that his comments might have invaded a little bit of the privacy of Dr. West, and I was a little surprised. Under what circumstances should a doctor be commenting when he's treated a patient?
Right. I think that there's an entire patient-doctor trust that exists and that really needs to be there. And for doctors to actually give out information about a patient, I think is wrong. Only time I think that if it's medically relevant to the patient's care is the only time where I think any type of information needs to be disclosed.
And in this situation, we can certainly say it's not medically relevant.
It's not medically relevant at this time. You know, I think that it would matter only after the fact when the autopsy is done and we know exactly what's going on. Then if that information needs to come into light, then I think it should.
Certainly. I want to thank you for putting this all in perspective for us. I want to thank Dr. Jan Trokel. Up next, it is indeed my open letter on mothers and the love only they can give to us. Don't miss it.